My name is Jim Fiala. I'm a trauma critical care nurse at LA County UC Medical Center. 15 years ago, I had a severe bulge in my C3, C4 back of my spine, and it was causing severe pain in my neck and in the inside of my hand. Meanwhile, the other side was complete numbness. And I could no longer raise my arm, I couldn't swim, couldn't do the butterfly, couldn't lean down and cycle prone, whatever. It made it very hard. So went through my Kaiser, they did all these things, tractions, therapies, everything, and after 6 or 8 months of lots of expensive therapies and so forth, which my insurance paid for, got no results. I was in still a lot of pain, I could hardly move my arm, couldn't raise it and so forth. And so finally the therapist said, Jim, you either have injections, which is just a palliative thing, just like a Band-Aid, you have a disc replacement, or you have cervical fusion, which I've seen a lot of the surgeries, and the long-term outcomes have not come out well, and I would have very little movement in my neck, which I like for swimming and other things. So finally she goes, Jim, we haven't gotten much success out of this, but this is a last-ditch effort. Hardly anybody gets anything out of it, but here's a sheet, try it, you might get some help, but no one has gotten any help out of this really yet. And so, but give it a try. So I went home, okay, back up, and I tried it, and it was extremely painful. I had to take 2 Tylenol codeine number 3s just to deal with the pain while I was starting it, and it says to do it 15 or 20 minutes a day. And well, I started doing it several times a day, then I did like an hour a day, then 2 hours a day at different times. After a week, I could finally sleep without severe neck pain. A couple of weeks, I could start moving my arms around. A month, I could ride my bicycle fine. 3 months later, it was like it never happened. And it was like, wow. So it basically pulls all your spine apart completely straight when you see this traction. And when you go to chiropractors, they just twist your neck, do this and that, but they don't regenerate the space that's in there. This regenerates the space, and it pulls it 100% accurate and correct. And so it just takes a little bit of time and effort. A lot of the people that I've shown this to, several of them no longer needed to do their spinal surgeries, which it saved them a lot of money, a lot of pain, and so forth. So what I'm going to show you here is how I do it. You basically just need a regular towel and a 3.5 or 4 foot cord. I'm going to show you, I just take this right here, I take it like this, and I tie a knot, okay, and just make a loop. And what you do is with that loop, you loop it again, so now anything you put in there pulls tight. And I've done that to this end also. So what you do is you take your towel, any size towel, medium to small is better. It doesn't have to be anything fancy. You roll like this, you bundle it up. Take one of the cinched ends, put like there, so the more it pulls is tighter, and you take this end here, I'm going to loop it through there, tie it around here, and I'm going to put it right there. And you want to barely touch the ground there. And if you're on a slick floor, back up, you got to put down like one of these cheap mats, 15 or 20 bucks at Big Five or Walmart. And what you want to do is lay down and take just the folded edge and slowly slide away and put it just around your ears until there's no ripples, until it's really comfortable. And you keep pulling away, and you'll want to get 2 finger space between your head, and then just rest there. And this will slowly start pulling your neck. And every couple minutes you go like this, and you're going to feel some crinking in your spine, like, oh my gosh, something's, whatever, it's rubbing. But after you spend a couple weeks or a month, all that crinking will go away because your spine is no longer grinding on itself and compressing the bulging discs. And I did this after 3 months, and I got excellent response, and it is wonderful. And so when you pull out a little bit more, sometimes right now I'm getting almost 4 finger space. You'll put a lot of pressure on it, but you slowly need to build up the time and the effort, and you want to have a stopwatch or alarm so you don't sit here and almost go to sleep sometimes on it. I'll do this every couple of minutes, and it feels wonderful. And like I said, if you have any upper neck pain, this is generally the cause of a bulging or herniated disc in the upper part, and this will slowly pull it apart and allow the bulge to go back in. And I've been taking glucosamine with chondroitin
and just some like those hyaluronic acid and MSM things also. And that seems to, if it works for the joints, I figured it would work for this, so that's what I've done. So hopefully that'll be helpful to anyone that is watching this video. And may God bless you, and hopefully it worked for you. Thank you.